Frontal bone. The frontal bone is irregular, flat, and pneumatic bone. Why pneumatic bone? Because it has air spaces. The frontal bone has 6 parts: squamous part, nasal part, 2 zygomatic process, and 2 orbital plates. The squamous part has two surfaces, external surface and internal surface, and it has two borders, superior or parietal border and inferior or supraorbital border. The squamous, the external surface is covered by the external surface is covered by frontal belly of the occipitofrontalis and epicranial aponeurosis. Then it has epicranial, and it has superciliary arch, and at the middle it has glabella. Then it has frontal tuberosity or frontal eminence. The importance of this area is the ossification starts from here, and also it forms the pole of the cerebrum. Then the internal surface has sagittal sulcus. The sagittal sulcus has sagittal sinus. At the floor it has the sinus, and at the lip it has the falx cerebri. Now the zygomatic process. The zygomatic process has two border, superior temporal border and inferior temporal border. And now the orbital plate has fossa. This is called the lacrimal fossa. The lacrimal fossa lodges the lacrimal gland, and this is called the trochlear fossa. The trochlear fossa lodges the trochlear gland. The trochlear fossa, it doesn't lodge anything, but the trochlea mainly a fibrous band, so it holds the tendon of the superior oblique muscle. Now the nasal part. It articulates with 3 types of bone: maxilla, the frontal process of the maxilla; N, nasal bone; and L, lacrimal bone. And the nasal spine. It articulates with the nasal crest of the nasal bone, and also the perpendicular plate of the ethmoid bone. So this is all for the frontal bone.